it's been a dark 2 weeks. It's felt a lot like grief, grief over on so many levels, right?
A judge has paused some elements of President Trump's attempt to shut down the US Agency for International Development. Judge Carl Nichols, who was appointed by Trump in 2019, said he was pausing the administrative leave of more than 2,000 employees and a plan to withdraw nearly all of the agency's overseas workers.
His order is the latest intervention by a court to slow or limit President Trump's agenda. There have already been rulings that block, for now, Mr. Trump's attempts to freeze federal spending and overturn birthright citizenship.
The UK's Foreign Secretary David Lammy called Donald Trump's plans to make cuts to US A.I.D a big strategic mistake. He said the move allows China to step in and expand its global influence. Well, Annie Linn is now a former senior community health advisor at the US President's Malaria Initiative, PMI, who was laid off at the end of January.
USAID has gotten strong bipartisan support, particularly the Malaria Initiative, and so we were definitely expecting that there would be a change in priorities when a new, presidential appointee came in and was in charge of the initiative, and certainly preparing to, onboard somebody new and understand what their priorities were and showcase our work and, showcase the value of it. But never in my wildest dreams could I have imagined what happened. Like you've mentioned, there was an executive order on the first day, and really that was around pausing new funding that would be going out. And then on that Friday is when a cable came out from Secretary Rubio that was saying that implementing this executive order was going to entail a full stop on all foreign aid. So existing work that was already happening, no matter what stage was in, or how many resources had gone into getting it to the stage it had to stop immediately.
And how do you feel about it now? We're nearly 2 weeks later.
Now, it's been a dark 2 weeks. It's felt a lot like grief, grief over on so many levels, right? There's, my own personal job. I was laid off. I was a contract employee, and so my contract was, I received a stop work order in accordance with the cable that was sent out on that following Monday, and then by that Tuesday I was laid off. And so, the loss of my personal job, like the job that was so meaningful to me, it was, a vocation. I felt like it was where my greatest gift that met the world's greatest need. And also knowing that so many of my colleagues that I respect so much were going through the exact same thing. And, my close colleagues from PMI, but also the entire global health community that has received US A.I.D funding are basically just, waiting to see what's going to happen and worrying that they're going to lose their jobs. So grieving for what's happening for my whole professional community. And that's not even touching the real story, which is the impacts of the people that we have been serving and that the countries we have been partnering with to, take on all the goals of USAID, the goals of reducing deaths from malaria, the goals of, increasing, the well-being of children and increasing prosperity of communities around the world.
Do you, Annie, know how many lives you've saved, how many malaria cases you've prevented?
There's data out there, and it's one challenge that's happened is that all of the documentation from PMI.gov went dark over the weekend. And so all these, documents that we had that were like easy to show exactly the numbers of cases averted and deaths saved or deaths prevented, the modeling that's gone into that to try to estimate that, that's all hard to find, and kind of trying to scramble to figure out that documentation. Broadly speaking, malaria still kills close to 600,000 people every year. That was the estimate for 2023. But when we looked for the numbers for the countries that PMI has been working in, since 2006, when the initiative was founded, the malaria mortality rate was reduced by half. So that's a huge,
a huge effect. And look, I've been digging around the latest PMI report, and you are the US President's Malaria Initiative. Of course, this is what it's been. It's been ditched. It's got the US President's name on it, incredibly. But the latest data that I've found says that your initiative helped to save 11.7 million lives and prevent 2.1 billion malaria cases since 2000. Annie, look, there is a massive spend by the US on foreign aid. It only makes up 1% of your total US federal budget. But according to the United Nations, the US provides about 42% of all humanitarian aid the organisation tracked last year in 2024. So in terms of percentages, the US is a huge contributor. Is there an argument to say that actually the US was giving a disproportionate amount of money compared to other countries? It should be for other countries to step up.
I mean, of course, that argument can be made, but I mean, the U.S. always we talk about our, American greatness or American exceptionalism, and that is one way that we have been great and exceptional in the world and have garnered so much goodwill through our relationships with countries where we've worked. And certainly it's not perfect, and there's always room for improvement. And I think, a review of the programs would be welcome, but to cut it off so drastically, I mean, because of that percentage, I mean, it is such an enormous impact in so many countries across so many areas. And so I think if we did want to reduce that percentage, then let's come up with a plan to do that over the course of time to give countries and other partners time to plan appropriately and make sure that we're leveraging each other's contributions correctly and and partnering to make sure that things are done and effectively without duplicating efforts. All those kinds of planning. We take partnerships really seriously, or have, and we try to be really strategic with how we best utilize our resources. For malaria, PMI was the biggest donor alongside the Global Fund, and so there's lots of private donors as well, and there was so much work that went on in terms of making sure that we partnered with them in a way that was smart and was the best use of our taxpayer resources and the expertise that we had. So I think it can't just happen overnight, and just stopping all of that.
It needs to be a phased rundown. And look, there is probably scope within every department, within every initiative, to perhaps make some savings, but you argue it should be done over a period of time. Look, Annie Linn, thank you for speaking to us. Huge apologies about the loss of your job. You now, of course, need to work out what your next step is. And of course, many malaria initiatives around the world will need to work out where they go after this as well. Annie Linn, thank you, former Senior Community Health Advisor at the US President's Malaria Initiative, the PMI. Thank you. Annie Linn there. Just extraordinary what is happening over there. I'm sure that some fat could have been done with being shaved, and that's always a good thing to do, but just huge swathes of job losses there. 10,000 employees is the aim to get rid of, but we now know that a judge has paused the plan to put 2,000 employees on administrative leave. That is despite people like Annie Linn already having lost their jobs.